Hello, everyone. This is Dr. Evangeline Obi. I am here today to talk about our health, our vision. When we talk about health, we talk about the whole person, every system. We just finished the cardiovascular system. And today we're talking about the vision, the eyes. Can we see? Is it important to see? Yes, it is very important to see, and not just see, but see very well, clearly. We have to make sure that our vision health is maintained. And why is vision health important to a nation? Vision health is very important, and when there is a high vision problem, it is a public health problem. In America, recent study shows that 3.4 million or more of Americans aged 40 years and above are blind or visually impaired. 3.4 million. That is significant. And this is expected to double by the year 2030 if there is no community effort to stop this. And we have to do this by awareness, by education, talking about healthy lifestyle changes. It also impacts health when we live poorly, when we eat the wrong foods, when we don't exercise and gain weight, when we don't take the right vitamins, when we don't get the right health screenings. All these impact our health and especially our vision. Without vision, our quality of life is impaired. You can imagine, just for a few minutes, close your eyes and just think, if you're not able to see where you're going to, what you're doing, what the next person around you, who that person is and what they're doing, if you cannot see and appreciate all these things, it can be depressing, it can be frustrating. You may not want to do everything you want to do out of frustration or depression. It may tip into other conditions because you can't walk, you can't run, you can't do active exercises unless if you are really motivated to do those, even with your impairment. So vision health is very important. And it also impacts not just the person, but also productivity and the economic burden to the country. So it's supposed to cost, in America, it says that more than 35 billion per year is the cost of maintaining all the blind people in the country. So maintaining vision health is very important. So when we as Ministry Wellness Center, our goal is preventive medicine, prevention, teaching or letting people know how to maintain wellness and avoid diseases, chronic diseases. So for vision health, how do we prevent vision problems? Early detection is important. It is recommended that people get screened 1 to 2 years, at most every 2 years, get a comprehensive eye exam by a well-trained eye doctor to look in the eyes. And the best way to do this examination is by dilating tests. They will put a liquid in your eyes that will dilate your eyes so they can look behind the eyes and see. This way they can detect early diseases of the eyes. So dilated comprehensive eye exam with dilation is recommended at least once every 2 years. So that is how to prevent eye problems. Other ways to prevent it, when we talk about healthy lifestyle changes, eating healthy, the right food, fruits and vegetables, food rich in those help protect the eyes. Taking the right vitamins and minerals for eye health is also important. Carrots are good for the eyes. Green leafy vegetables are good for the eyes, like spinach, kale, collards are good for the vision. Next is maintaining healthy weight. So maintain healthy weight, because the more weight you gain, the more you have calorie, cholesterol, and all those can impact the vision, impacts the blood flow to the eyes. Diabetes can develop, which is a common cause of eye blindness in the United States, with glaucoma, cataract. So every diabetic should get annual eye exam to check for diabetic retinopathy, which leads to blindness if not well taken care of. So protect your eyes by living a healthy lifestyle. And also blood pressure, if it's high, make sure it's controlled, because that can put a strain on the eye vessels and start leading to vision loss. Also, quit smoking. Smoking is not good for you. It helps building plaque buildup in the eyes and can lead to, research has linked smoking to increased risk of developing age-related macular degeneration, cataracts, optic nerve damage, and all this can lead to blindness. So quit smoking, eat healthy, rest your eyes, learn to rest it, get enough sleep. That protects the eyes. And when we talked about early screening and detection, the United States Preventive Service Task Force recommends that children between the ages of 3 and 5 years old should at least get one eye exam to make sure there's no detection of early eye disease. Another way of preventing is know your family history. If you have a family history of some eye conditions, start treatment on time. If you have a family history of diabetes, start getting checked on time. Make sure you're not diabetic and it's not impacting your eyes. And get some rest. Wear protective eye shields, eyeglasses, goggles to protect your vision from the rays, the ultraviolet rays. Also, we talked about resting your eyes. CDC came up with the 20-20-20 rule, which means that after every 20 minutes of using a screen, be it your phone or your tablet, computer, look away, at least 20 feet away, to relax your eyes and stare at it for like 20 seconds, and then you get back to your screen. So intermittent rest of the eyes helps reduce the effect of the screen to the eyes, because constantly focusing on the screen for hours, long hours, can lead to early eye vision impairment. So learn to rest your eyes intermittently, and of course at night, get good sleep. Make sure you're sleeping well. And if you wear contacts, make sure you wash them well, you take care of them as directed with clean hands. Always wash your hands before you put in your contacts or take them out, and disinfect them as directed. And don't wear them for a long time, because those can lead to infection in the eyes. We talked about eating right, maintaining good weight, and know your family history with smoking. These are healthy things you can do. What are some of the things that can affect the eyes? We talked about direct trauma. If you wear contacts for a long time, it can affect your cornea, cause infection. Or maybe if you're in healthcare and you do secretions, touch secretions, and don't wear the right face shields to protect your eyes, you might have splashes of things in your eyes, and this can lead to infections. Sometimes it's infections that gets transmitted to secretions, and some of them can be sexually transmitted. The simplest virus can be there, cause burning pain in the eyes. And shingles is also a virus that can affect the eyes, especially if you don't have enough immunity. That is one of the reasons we tell people get shingles vaccine updates at age 50 years and above. Certain diseases can affect the eyes, like diabetes, stroke, heart disease. All this can impact the heart. When people have stroke or are having stroke, there is what we call amaurosis fugax. It's a complete blindness on one eye that is intermittent. Or when blood pressure is high or health conditions, people can see floaters or specks or things in their vision. These are gradual impairments due to sclerosis or impaired blood flow to the eyes. Of course, age. As we get older, there is buildup of residues in the eyes that can lead to cataract. Also, they can increase pressure, glaucoma, macular degeneration. Some of them are age-related, so that's why we need to start on time to protect our eyes and take the right vitamins. So vision is very important, especially for children and also for elderly people. When people start getting vision impairment, Children, especially when it's not detected, they lose focus in reading because they're not seeing well. And unless if they are screened, you cannot tell who has vision issue. That's why it's good to get screened. But when children have this vision issue, it might be reading for a learning disorder, they don't want to see it, or even a hyperactivity, because all they can do is play and be loud, but they cannot focus and read and study. Their grades start to suffer and they may drop out of school. And finally, self-esteem, when it's late and they cannot see, they begin to withdraw. They may get involved in harmful activities just because they can't see and they are depressed or frustrated and don't know how to talk to someone. So it can lead to some behavioral changes in children. So early detection and management is important. And some of the problems that children can have can be refractory errors, which is nearsightedness, hyperopia, which is farsightedness, or astigmatism. And this can carry on to older age. Then in the elderly, vision issue is common. Most of them is age-related. Others are disease due to disease condition or just not detecting on time, and starts leading to early blindness. So, and this can lead to poor executive function. They start not able to balance their checks, not able to read, not able to drive, not able to do things for themselves. And not everybody likes to depend on others, and that can lead to depression, anxiety, and sometimes accidents. They can fall when they don't see well where they're going to, they can fall, and there's risk of fracture and even early death, when you're old and you're weak from not moving too much because of poor vision and falling and fracturing. It's like a vicious cycle. So vision is very important. Get checked, get your vision checked at least every 2 years at most, annually if you can. Get it checked. Make sure if you need glasses, you're wearing your glasses. If you use contacts, you're wearing it and doing that appropriately to reduce infection. And if your vision is okay, fine, maintain it, protect it, wear protective glasses, and eat the right food, vitamins, minerals to support the vision, like carrots, green leafy vegetables, and avoid harmful things like smoking. And if you have disease conditions that can impact your vision, like diabetes, hypertension, get checked on time annually and do the right things to control those disease conditions. Vision health is important. It helps you as a person, it protects you, helps those around you, and also helps the community and the nation at large. So this is Dr. Evangeline Obi with Ministry Wellness Center, encouraging everyone to maintain vision health. Thank you. Bye-bye.